Good afternoon, everyone. Good afternoon. Welcome again to our recovery support group. This is a meeting where we deal with all types of recovery information. So today I'm going to bring you an article from verywellmind.com. And so this is one of our mentor leadership modeling, role modeling aspect of recovery. And so in order for us to be the best person or best person that can exemplify leadership roles or model good behavior, I thought that I would bring an article that's very, very informative, if I must say. And so today's topic is CBT for alcoholism and drug addiction. Does it work? All right. So today CBT stands for cognitive behavioral therapy for alcoholism and drug addiction. So the question of the day is, of this hour, does it work? Does cognitive behavioral therapy work? So without further ado, my name is Craig, and so I am someone who's in recovery, and so I'm going to be sharing this article with you, and I hope you get something out of it, and I hope you enjoy the information. All right, I am someone who comes from the therapeutic recovery community, and so this information has really taught me a lot to address my behavior and my recovery as well. So let's get right into it. So the article starts off by saying cognitive behavioral therapy is a psychotherapy approach that can be used to help treat substance use disorder. All right. So it says cognitive behavioral therapy is commonly used to treat depression, anxiety disorders, phobias, and other mental disorders. But it has also been shown to be valuable in treating alcoholism and drug addiction. This is especially true when it's part of an overall program of recovery. All right. So CBT helps people learn to better identify the negative and self-defeating thoughts and actions that can contribute to substance use. It is a short-term, focused therapeutic approach to helping drug-dependent people become abstinent. So it goes on to say CBT uses the same learning processes that led to the development of alcohol and drug dependency in the first place to help people unlearn maladaptive behavior. So you may ask, what is maladaptive behaviors? All right. So maladaptive stands for unhealthy behaviors. All right. And so let's go on to one of the topics or topic of discussion that we want to talk about, that I'm going to read, is how CBT works for substance use. It is used to treat alcohol and drug dependence. CBT has two main components: functional analysis and skills training. All right, so we're going to deal with the first one first, and that is functional analysis. Functional analysis is a process in CBT, better known as cognitive behavior, that involves looking at the causes and consequences of a behavior. Working together, the therapist and individual try to identify the thoughts, feelings, and circumstances that led to and followed drinking or using. This helps determine the risks that are likely to lead to a relapse. When doing functional analysis, a therapist might ask the individual questions designed to gain insight into how a person was thinking or feeling before the behavior. All right. And so now I just read something and it brought to my attention just by reading the word therapist. And so I am a recovery coach. I am not a therapist. I'm not someone's sponsor. I'm not a counselor. And so that is done through the professional treatment aspect of it. This portion of this article is basically to bring you some guiding information in the hopes of uh, giving you some insight on both aspect of the addiction, from the consumption and the behavior, the treatment of how to avoid relapse and all that good stuff. All right. And so, and preventative measures. And so let me put that in. Preventative measure and relapse. All right. And so here we go. So it says, this helps determine the risks that are likely to lead to relapse. When doing functional analysis, a therapist might ask the individual questions designed to gain insight into how a person was thinking or feeling before the behaviors. They may ask the client to recall the last time they used a substance and then ask, listen up, then they may ask, what were you doing before you used the substance? All right. And so now it's a question that's been asked, what were the person doing before or prior to the substance? Then it goes on and ask, how were you feeling? Right? Then it goes on to ask again, what happened right before? Did anything positive happen as a result of the behavior? This is some good stuff. I'm from the old school of the ABC module, where it talks about the A stands for activating event. B is the belief or the thought process or the core belief or self-talk that one has, and C is the consequences thereof. Was it positive or was it negative? And so if you could just use those three steps: A, activating event, which is your perception; B, the belief, core belief, or self-talk that you having within yourself about the perceived event; and C, what was the consequences of both. Because you can't have one without the other. So all three of these work in conjunction together to bring about a greater clarity and outcome. And so you have to be able to identify what are the behaviors. All right. So lastly, it asks, what were the negative consequences of your actions? All right, let's move on. Functional analysis can also give insight into why they drink or use drugs in the first place. People may examine the situation, emotions, and thoughts that play a role in their drug or alcohol use. This helps identify situations in which the person has coping difficulties. By better understanding the difficulties that contribute to substance use, people can then look for ways to better manage difficult thoughts, emotions, or situations. All right, so that was the first aspect of CBT. First one was functional analysis. Now, the next one we want to talk about, and that is skill training. Skills training, right? When people are struggling with difficult situations, life stress, trauma, anxiety, depression, or other problems, they sometimes turn to substance or alcohol use as a way to manage. If someone is at the point where they need professional treatment for their addiction, chances are they are using alcohol or drugs as their main means of coping with problem. Okay, so oftentimes, if a person don't seek the professional help, they may turn to uh, a crutch, or they may turn to what we call masking uh, some of the trauma, stress, anxiety, and depression by using alcohol or drugs. All right. The goal of CBT, better known as cognitive behavior therapy, is to get the person to unlearn maladaptive, unhealthy behaviors and learn or relearn better coping skills. All right? By learning such skills, they can then start working to apply them in situations that could typically trigger drug or alcohol use. Skills training works by, here we go. First point is helping individual unlearn old habits and learn to develop healthier skills and habits. And so, what that basically is entailing is that there is a method called or a process called positive reinforcement. When they talk about unlearning bad old habits and learning new habits, that is replacing old negative thought or self-talk that one may have and replacing it with positive. Removing negative, replacing with a positive. So that's why it's called positive reinforcement. Looking things from the bigger picture. All right. The second point the article makes, educating people about ways to change how they think about their substance use, abuse, excuse me. Learning new ways to cope with situations and circumstances that led to their drinking or drugging episodes in the past. Another aspect of skill training is helping people learn to better tolerate feelings of distress. This way, people can manage their feelings of anxiety or depression in positive ways. Rather than turning to substance misuse for a quick fix, substituting old habits that contribute to substance use with more positive and enduring action enhances a person's ability to function and aids in long-term recovery. All right? How CBT teaches coping skills. All right. And so that is the two aspects, the two main components of CBT. First one we covered was functional analysis, right? Talked about that. And then we talked about skill training, right? And so next topic we want to discuss or share, benefits of CBT for alcoholism and addiction, benefits of cognitive behavioral therapy for alcoholism and addiction. People who have a substance or alcohol use disorder may often struggle with negative feelings or thoughts that make recovery more difficult. So, all right? Because CBT focuses on identifying and replacing such thought patterns with more adaptive ones, it can help improve a person's outlook and support skills that support long-term recovery. Some of the ways that CBT can be beneficial for people who have an addiction includes, listen up, learning to identify self-destructive thoughts and actions. So now you're getting into the aspect of the benefits of it. And so some of the benefit is, as I just read, so learning to identify self-destructive thoughts and actions. So now it's asking us to basically do a self-inventory of ourselves. And so if you've ever been to any support group, most support group may mention do a moral self-inventory of yourself. All right. And so that is some good stuff to process. All right. If you're having a bad day, or let's say you're dealing with some emotions that need to be identified immediately so that you can regulate the emotion appropriately. So these things are really helpful in the long run. And so a lot of times we may feel ourselves, our emotions getting overwhelmed, whereas we may have to pause and relax and think of some healthy exercises that can calm us down. And being able to identify our feelings is very important. All right. And so I'm currently reading a book called Emotional Intelligent Habits. And these are some of the things that help keep me grounded when I'm dealing with personal competency. And so there is four components of personal competency. One is self-awareness, and the other one is self-management. Then the other aspect is social awareness and relationship management. And so all four of those work hand in hand. So let's get back to the article. So it says, we're talking about benefits of CBT for alcoholism and addiction. Finding ways to monitor such thought patterns. Learning new, more adaptive ways of thinking, right? And so we remember we read about maladaptive, unhealthy behavior, right? We read about maladaptive behaviors. Now we're going to do an assessment of adaptive ways of thinking, all right? So we take on a new form, a new approach of how we process information, all right? And so information can come from all types of cues or stimuli, however you want to call it, or things that you can identify with signals and put them all together. But looking at it from a positive perspective, because we know anytime we start having thinking, a lot of times these distorted thought process gets us, well, I know, let me keep the focus on myself. I know anytime I have stinking thinking, the end result, if I'm not able to identify it immediately, is a bad outcome. So a lot of times I have to stop and pause and process the information clearly so that I can respond appropriately. So the next part of benefits of CBT for alcoholism and addiction, it says applying skills that have been learned in new situations and settings. And the fourth one talks about exploring new ways to handle stress and difficulties. In the treatment of alcohol and drug dependence, CBT can help a person, number one, improve self-control. Two, recognize situations in which they are most likely to drink or use drugs. Avoid triggering substances if possible. Develop coping strategies that would help when they are faced with situations that trigger cravings. All right. And the last part of it says coping with other problems and behaviors that may lead to substance abuse. And so one of the things, as I began to read this part or this portion of the article, one of the things that we learned to identify not only the stress and the anxiety and depression, but also some of our triggers, urges, and cravings, right? And so that's something that you must be mindful, pay close attention to it, because that can creep in easily if you're not able to identify them and dismiss them or replace those with something as an alternative from maladaptive behaviors to adaptive thinking. All right. So it says the primary goal of CBT in the treatment of substance use are to improve motivation, learn new coping skills, change old habits, and learn to better manage painful feelings. Research suggests that the skills obtained through CBT are enduring and can also be applied in other areas of an individual life as well. Approximately 60% of people who are treated with cognitive behavior therapy for a substance use problem are able to maintain their recovery for a year. How long does treatment take? Okay. And so that's a question I'm glad you asked. The article says because cognitive behavior therapy is a structured, goal-oriented educational process focused on immediate problems, the process is usually short-term. Although other forms of therapy can be long-term and are not time-limited. CBT is usually completed in 12 to 16 sessions with the therapist. Now, we're talking about a therapist, someone in the field of professionalism, someone who has actually went to school, who has profound knowledge uh, that deals with treating people with this module of cognitive behavior therapy. All right, so let's go into another topic before we end today, and that is effectiveness of CBT for alcoholism and addiction. So we talked about the benefits of it. We talked about how long does treatment take. Now we want to talk about the effectiveness of CBT for alcoholism and addiction. All right. So it says research has shown that CBT can be an effective treatment for substance use disorders, both on its own and in combination with other treatment strategies. CBT typically involves a number of distinct interventions, such as operant learning strategies, skill building, and motivational elements that can either be used on their own or combined. All right. And so that portion of uh, that we want to cover is so profound. All right. So now I'm going to read something that talks about get help now. And so this is part of the article. And so let's see what the article says. Cognitive behavior treatment are one of the most frequently evaluated psychosocial approaches to treating substance use disorder. Right? It says in these studies, CBT has been shown most effectively when compared with having no other treatment at all. When compared with other treatment approaches, studies have had mixed results. Some show CBT to be more effective, while others show it to be of equal but not greater effectiveness than other treatments. So it's really saying, this article is really saying that you can get help, you can get healthier from multiple pathways of recovery. So it don't have to always be CBT. I just want to bring this because a lot of times I think this challenges to me. Let me just keep the focus. A lot of times, I don't know if people overlook this or what, but this is what actually helped me. And so I'm under belief that if it can help me, along with other treatment methods. So it ain't just CBT, because remember, I stated earlier that I come from a therapeutic recovery community, a peer therapeutic recovery community. And so we also, while during my stay, we did CBT, we did AA, we did NA. And so we did all types of exercises that helped me in so many ways, not only by me looking within myself, but as other people look within themselves, but also by us sharing our information amongst one another. And we gain a whole lot of information that let us know that even though we don't have the the exact experiences, but we do have a lot of similarities and situations that we experience during our active stage of addiction. And so by that, we was able to discuss or look at the information or the coping skills that was being presented to us and finding solutions and ways to better look at our addiction from the inside out instead of the outside in. And so this is some good information. So I advise anyone that just want to read something dealing with addiction. It can be from multiple pathways, but if you want to look into cognitive behavior therapy for alcoholism and drug addiction, does it work? You can go online once again And you can pull this article up, and it's brought to us by verywellmind.com, right? So let me read the last aspect of it, and then we will be done for this session. So it goes on to say, as with other treatments for alcoholism and drug abuse, including pharmaceutical treatments, cognitive behavior therapy works best when combined with other recovery efforts. This includes participating in support groups like Alcoholics Anonymous or Narcotic Anonymous. Long story short, cognitive behavioral therapy works well for some, but not for everyone. Let me read that again because I don't want people to get misled or be under the impression that this is the only method. It says, long story short, cognitive behavioral therapy works well for some, but not for everyone. This is the case with all alcoholism and drug treatment approaches because every person, listen good, every person deals with and recovers from addiction in a different way. All right. And so that's it for this week. Hope you gained some information, some good information. I hope it can be of some use and some help. And so take care of yourself. My name is Craig. Until the next time. So long.